Good day, everyone. Thank you for joining us for today's webinar on breast cancer awareness. It's great to see so many people interested in learning more about this important topic. My name is Alima Tolubukola Jimo, and I'm a professional nurse midwife, breastfeeding counselor, maternal health advocate, and the founder of the Midwife Next Door. At the Midwife Next Door, we are committed to enhancing maternal and child health outcomes through education, community engagement, and access to healthcare services. This is because we believe that no woman should walk our journey alone, especially when it comes to health-related issues. So whether she is pregnant, breastfeeding, or facing other health challenges, including breast cancer, that is what we'll do. Today's webinar perfectly aligns perfectly aligns with our mission to empower women with knowledge and build a strong support system. I've come to realize that some women, especially in Nigeria and even Africa, they tend to present to the hospital when they have breast cancer issues, when the cases have gone out of hand.
Yeah.
I did a poll in my community because I have an active community where I tested and to know the knowledge of my community women on breast cancer. 10% of them are aware about what breast cancer is, and some even have family relations or acquaintances that is battling with this condition, or that the condition that's even claimed their life. So more reason why we are doing it. We realize that like 90 or even 80% of the entire population don't even know what breast cancer is. They had story that breast cancer is something that is deadly. Anybody that has breast cancer is like the person has signed a death contract. And that is why we are talking about breast cancer awareness. We are creating an awareness on breast cancer. And our theme today is know your risk, detect early, and never walk alone. We all know that breast cancer is a major health issue globally, and Nigeria is not exempt. However, with knowledge and timely intervention, many lives can be saved. And that is what today is all about, like helping our women understand their risk, how they can detect the signs early, and build supportive network around them. So before we dive into the session, let's do a quick poll. How many of us already know someone who has been affected by breast cancer? Kindly drop a heart emoji in the comments if you do. Let's keep it coming. Thank you. Thank you, Mrs. Ajarat. Thank you, Mrs. Kabirot. Thank you. Thank you very much. So with me here, I'm honored to have an amazing professional in person of Omoumi Islamiyat Olayinka. She is a registered nurse and public health advocate with a passion for empowering communities through health education. So rather than just talking about her, I would like to I will want her to speak for herself. Omoumi, please introduce. Let us meet you.
Thank you very much, and it's a pleasure, honestly, to be here today to talk to everybody. And like she said, my name is Omomi Islamiat Olayinka, a registered nurse, trained in Nigeria, but currently working in United Kingdom. Um, so, like she said, I'm a public health advocate, and I believe that there's no point if we're not constantly educating the community about their own health. I mean, it helps to improve the outcome of all of these disease that we think they are deadly. And it's also the theme of the topic is to never walk alone. It helps you to understand that there are people out here that will always give you the support whenever you need it. Thank you very much.
All right, thank you very much for that beautiful introduction. So we must have heard about breast cancer. Breast cancer. What poses a woman at risk of developing breast cancer?
So, first of all, we know what breast is, and then cancer, we might not know what it means. So basically, cancer is just a form of disease that it affects our own body cell, and it makes the cell to grow rapidly in an abnormal way. Fine, our cells are meant um to die and regrow, but the way cancer affects our cell, it makes them grow in a way that is abnormal. Just a layman language. So breast cancer basically it is when these cancerous cells, when our cells are affected by this, our breast cells in this case are affected by this cancer. So it makes um us develop a kind of rapid sudden growth. It's always painful, obviously. And then there are also some sort of symptoms, which we will be signs and symptoms, which we will be talking about later in this conversation. But so basically, breast cancer is just a form of cancer that affects our breasts. And sorry, what was the question again?
The risk factor. Yeah, thank you
So
very much for intro about breast
so
cancer. I
so
didn't.
um
Thank you. Continue,
so
please.
now regarding the factors now. So when we talk about factors, we always say it in medicine like cancer does not have a known cause. Like we don't know what exactly causes it, but through research, they've been like able to narrow it down to few things that okay, oh, these women that have breast cancer, what was it that was their lifestyle, or what was it that was their family history that made them come down with breast cancer? So this risk factor, if you do it, it doesn't mean you would have it. So that is what risk factor. It doesn't mean, oh, if I'm doing this thing, it's going to make me have breast cancer. It's just the fact that because they've done research, they realize that okay, all these women that came down with breast cancer, these are the things that they are doing, and these are the things we thought might have made them have this breast cancer. So number one is family history. So if you have a family member that has breast cancer, research made us know that um okay, so let me put it this way. If you have a family history of breast cancer and somebody that doesn't have a family history of breast cancer, there is probability of you having the breast cancer because you have somebody in your background. So it might be in your genetics. So there's probability of you having it and then somebody without no family history having it. So family history is number one thing. So we call it genetical factor. So it might be in your genetics and then you might later in life come up, you might later in life have that breast cancer or not have it. So you having a family with breast cancer doesn't mean you will have breast cancer. So it's just a risk factor, which I've explained earlier. And then some of our lifestyle, um, sorry, I'm off the this thing now, but I hope everybody can hear me. So some of our lifestyle also can actually make us have this breast cancer. Number one, another thing is consuming excessive alcohol because we all know that we might not know anyway. So alcohol has a way of like wrecking our body system itself. So it's not just breast cancer, it's like comes with a whole lot of package. So at the end of the day, it doesn't worth it. So alcohol, excessive alcohol consumption, we've seen women that consumes a lot of alcohol come down with breast cancer at the end of the day. And also sedentary lifestyle, like not engaging in lots of physical activity, not like just living your life however you want it, like eating food that are unhealthy, feeling like, oh, um, you notice that you're gaining weight, for example, and you know that this is not an healthy weight that you're gaining, and you're not looking for ways to shed those weight, probably because you're eating too much, probably because you are not engaging yourself in physical activity as much as you should. And to be fair, we Africans, we tend to like mix physical activity with stressful activity. I don't know how I can explain that in a way that will get it. So you going to work, you some people will be like, oh, at least I work Monday to Friday, I go to work or this, that. It's all this activity, they are not like they are not good. I mean, going to work is a different thing, but you're not saying that, oh, at least I go to work, at work, I work, I do this. it doesn't give yourself it doesn't give your body that kind of activity it needs. Like for example, it's not until we all go to gym that we can know that, oh, I'm involving in activity that is keeping my body and soul active. Like for example, maybe on a random morning you can choose to like walk a 30 minutes walk away from home and then back, and that's 1 hour. Even your body will be so grateful for that. So like little things that we like look away from kind of even more help us to keep our body and soul in shape. Or maybe you come back from work, you've rested, you've had something to eat. You can just like, okay, let me just take a stroll down the streets and or even maybe get a skipping rope, like just to keep your body like active. So, and also I've also mentioned this in sedentary lifestyle, unhealthy diet, also like eating all this processed food, saturated fat, consuming lots of red meat, and it is known that we in Africans we tend to like eat more red meat than other people. So that other people from and then we tend not to eat enough fruits and vegetables. And then the little people that eat, or let me not say little, I mean when we cook our vegetable, we tend to like overcook them. And which is at the end of the day, it's not really, really healthy to us. Although no single food can be directly like causes breast cancer, but along the line, like in the long run, when you like accumulate poor food over the time, it tends to like put you at a risk. And then smoking as well, um, birth control pills, some birth control pills. I mean, when people take it for a long time, they've seen people who takes birth control pill for a while to like come down with breast cancer at the end of the day. And then being exposed to chemical products, probably all these skincare that is now like the talk of the day. Like everybody wants to do skincare, not reading the ingredients that have been used to make that skincare. At the end of the day, we've seen people come down with not just breast cancer, all sorts of cancers with harmful chemicals in personal care products. Also, radiation exposure over time. I mean, maybe people that work in places like that they get exposed to radiation over time, they come down with cancers, and also lack of breastfeeding also can put you at risk of having breast cancer. So I think I'll stop there for now.
Thank you very much. You have said a lot, and that aspect of families made me remember when Angelina Jolie made headlines about for undergoing preventive double mastectomy. That is, she removed her two breasts when she realized that she's having a gene, BRCA1 gene, which is like a form of one of the mutation. If the gene is mutated, it can expose her or make her to come down with breast cancer later. So she totally removed the entire breast. And this will lead us to this conversation on how family history can influence one's an individual to develop this cancer, and what those with family history can do, the proactive actions or steps that they can take. Number one is that they can actually do a genetic testing, just like what Angelina Jolie did. You can do the testing is just about checking if you have what is known as BRCA1 or BRCA2 mutations or potential in your system. So once you do this, it can, most of those that have this gene, these genes are usually inherit, like you get it from your parent.
Yeah.
So once this gene inside your system, it can make you to be at risk of breast cancer like 55% on average. That according to research though. So you can actually do this genetic testing. And the second thing you can do is to ensure you are doing regular screening, do breast self examination, go if you are having any concerns about how your breast is looking, make sure you reach out to your healthcare provider and let them guide you through. Another steps you can also take is to maintain an healthy lifestyle, like you made mention, Omawumi, during the course of you talking
Yeah.
about factors, because some of us we are not embracing an healthy lifestyle, sedentary
No.
lifestyle, not eating healthy, smoking habits. So all these are things that pose or subject one to breast cancer, that can subject is a risk though. It's not necessary that you must have it. It's just like a potential factor of you having it. So
Yeah.
once you recognize the potential, it is best to just don't let it happen. And that aspect of healthy lifestyle will lead us to this question, Omowumi. And I just say, how does healthy lifestyle like diet or exercise impact or cause the risk of developing breast cancer? Do you get the question?
Yes. So like I said in my risk factor when I was listing the factors. I mean, um, it is not a single food that you eat that will make you have breast cancer. So all of these things tend to like accumulate over the years. It tends to like accumulate over the years. And the fact is, if we're not conscious, we just have to be conscious of it. Do you get like,
Yes.
of course we cannot do away with red meat. Of course, sometimes we are stranded. We cannot do away with canned food. Of course, I'm going to work, like I don't have the time to cook. I can just like, okay, let me just grab something in the shop to eat. But now making this part of our lifestyle, now making this our go-to diet every time is what is unhealthy. Is what is unhealthy. Like let's have a let's all cultivate the habit, even me inclusive, like in a day. Because I mean I like I said, I work in United Kingdom, and the first time the first time I had to come and work here, like during the break, and I saw my white colleague when they brought out their food. This is so funny. When they brought out their food, just tiny portion of food and then lot of fruits. In my head, I was like, me, I have my own big bowl of rice, no fruits. I mean, and then over time, I saw that they must anytime they eat, they would always eat fruits, and then sometimes they eat salad. I'll be like, "Ah, is it your salad that you used? Is it just salad you eat for all these long shifts, and then you just eat one tangerine on top of it?" But it's something they are used to. So honestly, if we kind of like we don't have to eat salad for the whole day, but like one of my colleagues would say, it's habit you cultivate over the time. Let's say today I bring my bowl of rice, but I'll make sure I have a fruit to go along with it. That way, I'm incorporating healthy diet into my food, and that way it becomes part of me. So we just have to be wary of it. We just have to be like conscious of it. Otherwise, we will not. Just put it at the back of your mind as you're going for my as I'm going for my grocery shopping this afternoon. I'm going to buy at least one fruit. That way you have two fruits. That way you have three fruits. I have a little one, and I always make sure so at least I expose that to fruits early enough. So even she knows that fruits. When she sees this, she knows that oh, that is apple. So even as adults, that is how we like cultivate the habit of at least today. If it is two red meat you always eat, I'll eat one red meat. Then tomorrow maybe I'll eat chicken. Like we just have to like sit down and look at our diet. And then when I'm cooking my vegetable, I know not to cook them for so long. It is we Nigerians that will first parboil the vegetable. Then we'll now cook the vegetable again. At the end of the day, there's no nutrient left. So honestly, we just have to like sit down, see what I'm eating. Like no, from what we eat regularly, we can actually create healthy food from it. It doesn't have to be salad, honestly. It doesn't have to be what these white people are eating. Just what you are eating. Know what you are eating, and then from there, try to like cultivate healthy eating from it.
Yeah.
Yeah.
Thank you very much. Thank you very, very much. I love that analysis. We overcooked our meals, like
Yeah,
our
we do.
vegetables. So all those nutritious, all the nutrients would have
Yeah.
volatile. So they would have disappeared. Just be taking roughages. Like I remember one of my guys, she would say, "You are just consuming grass. You are not
Yeah.
eating vegetables." So thank you very much for that. And that will lead us to misconceptions. Like there is something going around, going viral now that men should be sucking the breast of any woman in their lives. Is this really about misconception? Let's talk about misconception about who is most at risk. Is it the women or the men that are at risk? Because any problem like this, people always believe that it should be a woman's factor. So let's talk about misconception now.
So right. So about like you said, there are a lot of misconceptions going around on this breast cancer. First of all, it is not just women that get breast cancer. Even men get breast cancer. I mean, they have a breast, so it is only expected. But it's just that it is lesser in men compared to women. So it's we only women tend to like get the percentage, so to say, women is more than men, but at least men also do get it. And then another misconception is if I don't have it in my family, then I would not have it. So I'll use myself as an example. So I think that should be when I was in nursing school. I noticed a kind of lump in my breast. And then, I mean, I think I should be in my third year. And obviously, by third year, we already know what breast cancer is and all of those things. So in my head, I was like, this thing is not right. So I called my mom. I told my mom about that. Oh, I noticed a lump in my breast, but I'll keep checking it over time. And then I asked my mom, have you ever had anybody in the family that has breast cancer? Like, and then she said she's never had. And then thankfully, my grandmother is still alive. I called my grandmother as well. I asked her the same thing, and she said no, that she's never. And like our Yoruba mother will know it, jejere. So I asked her, she has got anybody ní jejere oyan ní family, and she said no. And then although my great grandmother was no longer alive, but I know her, and I knew she never had it when she was alive. So that way, me, I should not feel like because nobody has it in the family, oh, I cannot have it. So it can come from anybody. But anyway, like I was saying, I kept checking my breast and all. But at the point, I felt it wasn't increasing; it was just the same size. So for some reason, I felt like, oh, it's not cancer, obviously. So I went to the hospital. I went to see the doctor in the hospital, and I told her, she examined me, and then she said, oh, they have to take it out. So I had surgery. They did what they call biopsy, and it was just a benign lump. It wasn't malignant. So for people that are not healthcare, so it wasn't a cancerous lump. It's just a random lump. So um also, it doesn't have to be cancer, but research also has it that a lump like that, if it stays over time, it might become cancerous. So me now, I don't have any family member, not even a breast lump, because I know how our mothers can be like, clinic or clinic. I said, I was even the one reassuring them that it's nothing. So and then when we took it out and I took it to UCH, did test, and they said it was nothing. So that was when everybody was like, everybody had peace of mind. So that I don't have it in my family doesn't mean I cannot have breast cancer. So that's part of the misconception people have about breast cancer. Also, like you said, to sucking breast or whatever, it doesn't even have anything to do with, can they suck out cancer? If it's that easy, if it's that easy, nobody will have it in this. Nobody will have breast cancer. And also, some people believe that, oh, if breast is big, you have breast cancer. That's a lie.
Yeah.
That is a total lie. Like it doesn't have anything to do with breast size or anything. So far, you have cells in your breast. Cancer can affect any cell. Also, some people believe that wearing bra with underwire would also cause breast cancer. No, it has nothing to do with your the kind of bras you wear. Some also say when you wear antiperspirant, it causes breast cancer. Like it doesn't even have anything to do with, like they are not related at all. So also, a healthy lifestyle doesn't guarantee you that you'll be breast cancer free. It's just it just boils down to the fact that we know what self breast examination is, and we are always like checking. Like one of my lecturers would say, know your body. Know your body. Like nobody knows your body more than you do. You are the one that know if one breast is the same as the other. You are the one that would know, because obviously we're all clothed, isn't it? So I don't know what is under. So if you come to me for the first time, the first thing I'll ask you is this normal for you? So we all have to know our bodies. It's very, 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 very important. That is only when you would know if there is a deficient, like if one breast is getting bigger than the other. That is when you know. It is when you know your body. That it is when you know your body that you know if this place is paining me all of a sudden. It doesn't pain me before. It is what like, and this same lecturer will always say, learn how to touch yourself. There's nothing wrong in you doing self-breast examination. Like if you don't do it, who will do it? Like so if and also I was reading something about this breast cancer obviously recently, and then I realized that women in Africans tend to have the aggressive form of breast cancer because it is not detected on time. I've seen it's this same UK. So this same UK, I've once had a colleague. Actually, hers was cervical cancer, and then she was about 28 as at then when I met her, and then she said she was cleared of cancer. So, but a Nigerian would feel like, oh, I'm young, I cannot have cancer. No, it doesn't. It's part of the misconception. It doesn't work that way. So they'll be like, oh, I'm young, then I don't have to do all of these things. No. So when I got to this country, I had my child in this country, and then after about 6 months or thereabouts, I got a mail in my house that they want me to come for cervical screening. Then my husband saw this mail and he was like, cervical screening, ke, kilo shele, cancer, ke, kilo shele. Like I was like, it's just a random, it's just a random. So apparently, once you are a childbearing age in this country, like so they start calling you in for all of those things. So, but it's so sad that we don't have it in our country. But even at that, we still have to take our own health into our hands. Like if nobody is calling you for cervical screening, go and do pap smear. If nobody is calling you for mammogram, um, go and look for where they are doing it. To be fair, at the end of the day, it is our own health. And then, um, like we would always say, health is wealth. It is when you have that good health that you'll be able to spend all that money that you're accumulating. So please let us know our body. Let's be up and doing when it comes to our health. Let's always go for screening. Like it doesn't hurt you to go to a diagnostic center. Just tell them, or maybe just go to the hospital. Tell the doctor, oh please, I just want to have like a blood test this month. I just want to have a blood test this month. And they will do the blood test and they will see, oh, you are doing fine. At least you have peace of mind. It's not until we have millions of naira that we can do all these things. Just a random day, just go like, oh, I want to do pelvic scan or like all of those things. I want to do mammogram. I want to do. Nobody's going to say why you're doing it. It is you that know why you are doing it. So please, let's know our body. Let's take our health priority. It's not until we have a lot of money in our account that we start doing all these tests. So another example I have a Nigerian colleague. She's around the same age with me. She's around 27, 28 as well. She's a nurse as well. She came to this country and then she was diagnosed of fourth stage breast cancer. Fourth stage breast cancer. For somebody's breast cancer to have progressed to the fourth stage,
Mhm.
that means she's had it for a while. So all the while that she was in Nigeria, she didn't know.
Hmm.
She didn't know because we don't have this knowledge of going for random tests.
Mhm.
So I think she just had a test on, and then this country, when we come to this country as nurses, they tend to like do all these tests for us just to know that you are not at risk of anything. It was when I got to this country that I know that I have latent TB somewhere, and I was treated for it. In Nigeria, I never knew that I had like a TB line somewhere. So she didn't know, and then thankfully for her, she's in a country like this. She's getting all the treatment that she needs. It is not easy, but at least the fact that she's getting all that treatment. So it is so like I was like what I said about women in Africa and having the aggressive form is because we don't know on time. And then when we know, it's already like is gone awire. The prognosis is no longer good. Like the outcome of the treatment is no longer good. So like you will see people in this country that are living with cancer, and it's until they open their mouth to tell you that you know that, oh, they are living with cancer. So please let's take our health priority.
Thank you very much. Thank you very much.
Welcome.
If you are just joining us, welcome to our breastfeeding cancer prevention webinar. Kindly drop it in the comments where you are watching this from. We're talking about breast cancer risk, how to prevent it, and now we'll be delving into the signs and symptoms of breast cancer. Like, what are the signs? We have known the misconception of whether you have a family history of breast cancer or not, you can have breast cancer. And this is why early detection often improves survival rate.
Yeah.
You can be able to detect it, you need to understand, you need to know the signs. What are the typical signs that you should watch out for? And number one is hard lump. That is a hard lump in your breast or the one at your underarm, like underarm. Omowumi shared her experience or how she was able to manage her own lump when she realized that she had a lump in her breast. She reached out to her grandma, asked her mother how if there is any family history of breast cancer. So having a hard lump too can make you, it's one of the signs. Although 80% of these lumps are non-cancerous, that is, they don't contribute to cancer. Because when you have the lump, if you eventually have a surgery for it, that lump will be tested. We call it histology. They will do some screening on the lump to know whether is cancerous or it's just normal lump or normal tissue that just grow into lump. So you need to do this. You need to take any form of lump, whether you think it's just there or not. The lump, as long as it's not movable, and it's just hard. It may even be painless. Just reach out to your healthcare provider. Don't delay it till when the thing starts growing into another symptoms, which most times will not. But prevention is always better, it's always cheaper and safer. Another
Yeah.
signs that when one breast is suddenly becoming larger, like bigger than the other. Although it's very normal for the two breasts to be one to either be bigger than the other, but when
Yeah.
this is significant, the
Yeah.
symptom is very significant, please reach out to your healthcare provider. It's one of the signs. Though these signs, they are just they can be mild signs, but when once you reach out to your healthcare provider, either your doctor, they're able to tell you that no, this is not just your breast just growing, it is something that is happening. Like they're able to catch it earlier enough. Another signs you should also watch out for is dimpling. Like if you notice that your breast is having one form of orange changes, we call it pure the orange, like having this orange like shape. The skin of the breast is having that orange like shape. Please reach out to your doctor or any care provider. Another thing you can also watch out for is unexplained discharge. You are not a breastfeeding mom and milk is coming out of your breast, not even milk or pus or even bloody discharge, please go to the hospital. This is not a time to you to be asking for asking your sister or your aunt that is not in healthcare healthcare field about your breast is bringing out bloody discharge. Because I know of a woman, one of my dear patients, it was so painful. This woman, the breast developed. She noticed that she was having a boil on her breast. So she just thought that it's just normal boil. In fact, some will say that it's because you are carrying twins that you are having boil on your breast or one particular part of your body, especially maybe the boil is on your eyelid. So this woman just thought it's just normal boil. She went to the Hausa man to excise it for her, and that was
Mm.
how the boy starts getting bigger and bigger. Before she can even come to the hospital, it was so sad. Like the thing has metastasized, like it has entered all the organs, like the bloodstream, the liver, the lungs, everything. It was just management. We were just managing her, reassuring her that everything is fine. If this woman has understand that, okay, fine, I'm having boil, there is need for me to go to the hospital, she would have things were she wouldn't have the cancer wouldn't have spread all over her body. So
Yeah.
that's why we really need to take this aspect of understanding our breast. Like Omo said that get familiar with your breast, access yourself regularly, and that is the essence of doing regular screening. Like if you are familiar with your breast, you'll be able to note that last month my breast did not have lump. This month
Mm.
experience there is a hard lump in my breast. What could be happening? So you really need to understand why this thing is this. And reach out to your to healthcare professional. Reach out to healthcare professional, please. Emphasis on professional, so that we're able to guide you through.
Yeah.
Another, the last sign or symptom is just that when you are experiencing pain in either of the breast, either the left or the right side, oftentimes when the cancer is in the early stage, it will be subtle, like it won't be painful. It's just be normal. You can even go out with your activities of daily living, especially if you are not paying attention to your body system. So once you are feeling a pain in either of the breast, please reach out to your doctor or any healthcare provider or any healthcare professional, because small signs are often subtle, like they are just mild. It is when they get to the end stage, like because we have some stages of cancer. When they get to the end stage, that is when this cancer will become so painful, and little can be done when you reach out to the when you seek help, medical attention, when you seek medical attention. So that is the essence of catching it early, detecting it
Mm-hmm.
early. Once you detect it early, solution can be provided, and you will go about with your normal life. So that will lead us to what is the clinical breast examination, and how mammogram can help in early detection. Because I remember I remember having a client that she said she was having breast pain. So with my examination, I don't want to scare her. I just told her that she should go and do breast mammogram. She was like, "What is mammogram?" This is the first time she will hear it. I was like, how often do you do breast self examination? She said she's aware, but she doesn't really do it full time. So I told her, go to the hospital or any diagnostic center that has mammogram. So and she had the mammogram done, everything was fine. In fact, it was it was just maybe because her cycle was just she wasn't really paying attention. Maybe she was having, I think she was having poor posture. That was the reason for the pain. So everything was fine and everything is just perfect. So now I want us to understand. I want you to talk about what are the role of this clinical breast exam, because you won't be thinking about diagnosing if you don't. This our body is just like doing an ultrasound scan. If you don't do an ultrasound scan, we won't know. We won't be able to detect. There's some things that we won't be able to detect. These examinations will just give us like a broader picture of what is
Yeah.
happening in your system. So please,
Yeah.
Omowumi, tell us what are the role of this clinical breast exam and mammogram in early detection.
So mammogram is the basic and the most important diagnostic tool that they use when it comes to examining the breast, because and then the first one I'll say is just, I won't call it basic, but it's very important. I mean, it is when you're self-examining yourself, that is when you will know that something is wrong before you be able to go for mammogram. So it is always advisable that when you finish your menstrual cycle is the best time to examine yourself. It could just be when you're in the shower, or and it's always advisable to have like a mirror in front of you, so that way you can see what you're reflecting, isn't it? And then you can see better what you look like in the mirror. So after your menstrual cycle, maybe the second day or the third day, that way your body tissues, they are kind of like relaxed. They are not because during your cycle your body tissues tend to like be constricted. So if you examine yourself during that time when you're having your menstrual cycle, you can be you can detect the wrong thing, but after your cycle you feel like more relaxed and whole. So just put your hand over your head like this, and then from under your armpits up until your breast and all, you press for any lump. So we have a visual representation on the screen here. So you press around up onto your nipple, and then once you can't find any lump, you look at the color as well. You look at it properly. Is this the size that this thing was in the last few months? Even if it increases, it shouldn't be like significant increase. Like it shouldn't be significant. And then you try to press your nipple to see if you've got any discharge. So let's say you're pressing and then you feel some sort of lump. Report yourself to your healthcare provider, and then they would most likely also examine you. Like they will most likely like also press for you to see if there is anything. Of course, they would not want to give you like a vague answer, or let's say because obviously your healthcare provider, they are not magicians. They can't see through you. So in order to have like a broader picture, in order for them to like see what exactly is going on, they will send you for a mammogram. So this mammogram is what will now reveal everything. And if they find anything, they will let you know. If there is nothing, at least you'll be rest assured that, oh, there is nothing. So it is very, very, very important, as without this mammogram, like I said, they are not magicians. They will not see through you. So that is what's going to give them like a broader picture to see what is happening. And if they pick up anything, I mean, they'll be able to start treatment as soon as possible. And then if there is nothing, the only thing they'll just tell you is just keep checking every month, and then that is it, really. So it's nothing to be scared of. It's not so. Once they tell you, oh, go for mammogram, don't be like, oh, when, oh, maybe they found something. No, they just want to be sure, just to make sure that they are not missing anything from
Mm.
just examining you with their hand.
Thank you very much. And that is why it is very essential that once you are menstruating, breast self examination should be like your routine every month. And it is
Yeah,
best done after 3 to 7 days of your menses. So that this time breasts are less tender and you'll be able to get the accurate measurement. So to capture it all, get familiar with your breast.
yeah,
Once you are familiar with your breast, that is when you will know that there is something that is not regular
right. Yeah,
and you really need to seek the help of a healthcare provider. Thank you very much once again, Omoni. And that will lead us to why is emotional and psychological support important during diagnosis and treatment?
right. So honestly, whatever it is, any for any form of disease, we're not supposed to like be alone. How much more breast cancer? So the first thing is, I mean, if we get diagnosed of breast cancer, most often than not, we'll probably be the only one there with the doctor. So that is not now the time for us to like. I mean, it's a big deal. It's a big deal. It is a big deal. But we should always have it at the back of our mind that we should never do we should never go through the whole, let's say maybe they want to commence you on treatment. I mean, we should never go through all of that alone. It is a lot to take in. The fact that you got diagnosed, the fact that you don't know what the outcome is going to be, the fact that you don't know how your body will carry on with the treatment, because the chemotherapy is really, really like it's draining. It's not something like easy to deal with at the end of the day. So the first thing is people that you trust, people that that once you are at your lowest, they are happy to pick you up and do life with you genuinely at that point. Gather them, talk to them about it. That, oh, this is what is happening with me now. I've just been diagnosed with breast cancer. Like, I need you guys support as much as possible. On your visit to the hospital, if it's one person that you can go with them. At least they would be able to know your do's and don'ts. First of all, they'll be able to know that, okay, this is how they can. Because to be fair, family might not know how they want to support you. They might not know how they want to support you. So it is also important to make the process also easier for them as well, because it might be A, they are thinking, it might be B, you want. So it is as much as, first of all, you are going back to your family and friends to tell them that, oh, I've got this thing. As much as you are going through it emotionally, they are also going through it. So it is always best to like always make it easy for them as well. I mean, like I said, it's a big deal. It's not easy. But what are we trying to achieve at the end of the day? You want your health back, isn't it? And they also want the same. But how you want it, they don't know. and how they want to help you as well, they don't know. So it's always better to like make it easy for them that okay, oh, this and this is what I think you can do that will help me. So that thing in your mind, say it out. That don't feel like you're a burden to them. You are not a burden to them. They want to help you, so make it easier for them. So it is very, very important. Don't feel like, oh, it's a death sentence. It's not a death sentence. Once it is detected on time, it's not a death sentence. I've seen tons of people overcome cancer. I've seen tons of people beat cancer. So your home would not be different. So have good support system. Talk. Don't stop talking. If you feel like this thing, you are not comfortable with it. If you feel like, oh, this thing, it's weighing you down, talk to people. And if you feel like it's therapy you want, why not go for it? Some people feel better talking to people that they don't know
Yeah.
rather than talking to people they know. So go for therapy sessions. And if it's your healthcare provider too, definitely they are there to listen to you. If it's just a random, if you feel like, oh, I feel so stressed today, if it's just a random clinic day for you, you can break down. It's okay for you to break down in the consulting room. They are there to help you. They are there to support you. So you have your family members support you. You have your healthcare providers as well. They would support you all through that system, all through the all treatment. And also, I don't know if it's applicable in Nigeria, but in country like United Kingdom, you see that all these maybe breast cancer group, and they have all the support group that people of like mind, people that have the same disease, like um they would share their experience. They would share the things that they were able to do that made them like come out strong. So it's like a support group, like people of oh, some people are also they'll be like because you don't have the cancer, you don't know what I'm going through. So they feel like at ease. People that have the same cancer, at least they feel like these people know what I'm going through and
Mm.
they've gone through it. So join support group. Don't be ashamed. Like you don't. That's not the time for you to now like go into your bedroom. Like now, I mean, you won't get support that way. That is what I believe.
Yeah. Thank you
That
very
is what I believe. So yeah, it's very important to have that support.
Yeah, I think things are changing now in Nigeria. Most of these illnesses, people we now have support groups
Good.
for people living with breast cancer, irrespective of the kind of cancer that it is.
Hmm.
And thank you very much for that. And that will lead us to the final question, and that is emphasis on men. What role do men play in breast cancer awareness and support?
So for men, I mean, let's assume um husband for women living with breast cancer. So I think it just boils down to them being part of the family support we talk about.
Mm.
Like also, and aside from that, men should also like equip themselves with the knowledge of breast cancer. It is not the person that has breast cancer that will still come back to the house and still come and tell you like what is about. If
Okay.
you have a wife that has breast cancer, then start doing your research. It could be that oh, you know that oh maybe this food is not good for her to eat. Then you will know that she should not eat it in case you see her eating it. You know that she should not eat it. But if
Mm.
it's this kind of maybe she's going through depression, you'll be able to identify that oh this person is going into this my wife is going into depression, maybe because of the breast cancer. And then try to be their shield as well. Because there are days that they would be emotionally down.
Mm.
So it's very, very first of all, it's very important for them to like equip themselves with the knowledge of what breast cancer is, what to expect, what they would go through. So that way they'll be able to give the support they are supposed to give.
Yeah, thank you very much. In addition to that, the men in can even be reminding their wives or
Yeah,
women in lives that they should on the need to do breast self examination every
yeah,
month.
yeah.
Despite the fact that they are not their own exposure to cancer is less than, let's say, is limited, they can
Mm,
still, they can still empower themselves with the knowledge of the signs and symptoms of breast cancer. So thank you very much for today. Thank you. Thank you very
You're
much for.
welcome.
So we have come to the end of our prevention webinar on breast cancer. If you have any question, kindly drop it in the chat box. Any question at all? Any questions? Okay, so someone asked that what can those in attendance now, like what can they do to reduce their risk of cancer, of developing this breast cancer? Are you there, Omowumi?
Yes, I am. So,
Okay.
like we said earlier, risk factors doesn't mean if you are doing those things doesn't mean you will have it. And not having a family history also does not say you would have it or you would not have it. So I think in essence, it's just the importance of knowing what you're eating, like be conscious of what you're eating, be conscious of your lifestyle, and then the examination, it is the most important thing. Honestly, it is the most important thing. Knowing your body, like so that even if at the end of the day we have it, we are able to detect it on time and get treated on time. It is when we detect it on time and get treated on time, that is when the outcome of the disease is much much better. So overall, having a good lifestyle, not living sedentary lifestyle, knowing what we're eating, and then making sure we're examining ourselves all the time, all the time as well, would help us in general prevent it. And even if at the end of the day we have it, once we are
Yeah.
able to detect it on time, we get treatment on time, and that helps to improve the outcome of it as well.
Yes. Thank you very much. We have learned a lot today, from understanding the risk to the importance of early detection and the role of support system. I want to believe that we have also gained so much. So we have come to the end of the webinar, and let me briefly introduce our program, the Midwife Next Door, what we do to you. At the Midwife Next Door, we are committed to continuing these conversations, like, and providing resources to women. So you can join our community to stay informed and make your healthcare choices with confidence. Also, don't forget to schedule a breast examination this month, and
Yeah.
encourage someone, at least one person in your life, to do the same, because you can't walk this journey alone, and you are not even alone. So, Omowumi, okay, there is a
Thank you.
comment. Can pregnant women do breast self examination?
Yes. Well, yes, I'll say yes, honestly, because
Yeah.
obviously they are not doing menstruation. So, yeah.
Yes, you can. Yes, a pregnant woman can do breast self examination, Mrs. Ajara Tolanio. Thank you very much for that beautiful question. So, with this, let's continue the conversation in our community. I will still post the community access to it. Comment section. If you're watching this replay, kindly let us know where you're watching the replay from. Drop it in the comments, and see you next time. All
Thank
the
you.
our listeners.
Thank you. Bye.